Hello, everyone. I want to welcome you to Cellular Healing TV. This is episode 65. Now, this is David Asarnow, and Dr. Pompa and Warren are not with us today. They're actually enjoying a weekend at Lifebook up in Chicago with a group of natural health care practitioners. And today, we have a very special guest with us. We have Dr. Brad Gorski. Now, I had the opportunity to meet and get to know Dr. Brad Gorski about a year and a half ago when he became part of our program of practitioners. And he's got a very unique story on how he started his journey towards cellular healing. So first of all, Dr. Gorski, welcome to Cellular Healing TV.
Thanks, David. Appreciate you having me. Glad to be here.
It's our pleasure and our honor to have you here. Why don't you share a little bit about your journey and your story and how it all started along the cellular healing journey.
Yeah, for sure. It's funny. I always grew up being very healthy. I played college baseball. I was very into health, and about a year into our chiropractic practice, I'd started getting some really unusual symptoms. And my wife and I had moved into a house we were renting downtown in Charleston. And immediately upon moving in, I started getting really unusual symptoms, all the way from fatigue. Just like where I always was tired, which is very unusual because I eat well, I take care of myself, I do all the right stuff. My hands began to kind of swell up after working in the office all day long. So, kind of the course of a month or two, I started getting all these unusual symptoms. Of course, we kept getting better about nutrition. We kept, taking better supplements. And so we were doing everything that we knew right. Yeah. And long story short, some of these symptoms kind of kept coming on. And, over the course of my wife and I kind of sat down, we're like, we maybe think there's something in this home making me sick. Like I'm sure like so many of even I've had, a lot of my clients tell me, I think that all of a sudden I started noticing these symptoms after moving in a home. And, so I started getting these symptoms. We started thinking maybe that mold was a factor. We started checking for mold. Our house didn't have much mold in it at all. And long story short, I kind of just kept getting sicker and sicker despite no matter what we did. And we moved out of the home for 2 weeks. After 2 weeks, we moved in with my parents, which is always fun at 27. My wife and I we're like, well, hey, let's try this to see if I feel better. And move out for 2 weeks. Man, my energy started coming back up. I started feeling a lot better. So, we made the decision that we were going to have to move out of this home. That weekend, I flew to my best friend's wedding in Michigan. And I woke up the morning after giving my best man speech. I had a massive stroke. 4 different blood clots went to areas in my brain at 27. And so that's really what kind of put me on my path of really, although I was doing so many things right, there were obviously things that I was missing. And then obviously toxicity really is what really triggered my issue.
Well, let's step back. I mean, because obviously everyone just heard, wow, you were 27 years old and you had a stroke. And I mean, I know your story and it was like, oh my gosh. First of all, how did your life change that moment when that happened? And, what was the diagnosis? What did the medical doctors tell you, what was wrong and why it happened?
Yeah. When it first happened, too, I know one of my focuses was I can remember when it happened, like I had no function on the right side of my body. I couldn't speak, but in my mind, I always knew, I'm like, hey, I can beat this. I didn't know what it was. When it first happened, I figured I had brain cancer. But, what's interesting is I was in the hospital and, after they evaluated me, one of the things they said, well, you had a stroke. They ran, being in the course of the hospital over 2 weeks, they ran pretty much every test on me. And they said, what we're going to call it is they call it cryptogenic, which means there's no known cause. And actually, if you know anything about strokes, 40% of people who have a stroke, they call them quote unquote cryptogenic, which means we don't know why it happened, but as long as you take these blood thinners, most likely it won't happen again. And that was actually my diagnosis.
So as long as you take this, it may not happen again. That's really comforting.
Exactly. Yeah, and again, they had no idea. They're like, well, we maybe think you had a hole in your heart, and then they ran these tests on me. I didn't have it. So it was all these things, and I knew that kind of once we'd got out of the hospital, I kind of knew it was probably on it was on kind of my watch to get my health and my life back. Immediately, we started doing things like hyperbaric chamber to help my brain heal, which was amazing. But I also know too, I had to go back and figure out why. Again, I had this feeling of like there had to been a cause of why I got sick. And if I can find that cause and remove it, I knew my body would get well. And, truly that's, I think what kind of really kind of started me on my own health journey of saying that, hey, that it's on myself to figure out what's going on and why it happened. And then from there, really the next, 2 years was a learning process of doing anything, going to doctors, traveling, finding out how can I get myself well? And that's, again, I think I always tell you, I think my story and what I learned through going through my sickness is a lot of where I've learned a lot of what I've done is just getting myself well.
So how did things change? How did your diet change? What did you discover, about yourself, what was going on, your surroundings,
Talks a lot about
the root cause?
Yeah. One of the big things was, it was interesting, after I'd got out of the hospital, and here I am, probably the first 5 to 6 months of me getting out of the hospital, I come back, I have a full chiropractic practice that I'm taking care of. And, I can remember that was very tough on me. And I can remember anytime I would eat, no matter how healthy it was, if I tried to eat before noon, I was always getting sick. I was always throwing up. It was kind of interesting, my body was kind of telling me about intermittent fasting, which we've talked about on the show, that's how I started getting healthy, is that if I ever tried to eat before noon, I would get sick. Kind of like my body's way of saying, hey, I'm trying to heal, dummy, don't feed me. We kind of forget about those symptoms. I always joke about that, with clients, but
it's the signals that you actually were very aware. You started listening to the signals your body was sending.
There you go. Yeah, so I started doing, I know we've talked about, like the Swero, right? I started doing Swero. It's the only thing I could consume, in the morning before noon. And I wouldn't eat much through the day, and then it would come to dinner. And then, man, I would eat a lot at dinner. And that's actually really how I started getting better as far as nutritionally, because I had so many issues with my gut. I had so many issues with energy, not only just the process of healing from what happened with my brain. And, one of the big things and I'll tell you how we found out that really what happened to me was autoimmune related. We'd got back here to Charleston, and we started running, every test that really we could. We try to rule out genetic factors. They're like, it's not genes. And I had an autoimmune number in my blood work. There were 16 numbers that were positive that showed I had this. But it's interesting, but there's no known proof that it causes heart attack or stroke. But it's the only thing in my blood work that was abnormal.
Yeah. And so from once you understood and once you learned about, okay, well, it points to autoimmune, what changed then how you approached what you were doing to help yourself?
Yeah, it was huge. I think, part of what I started looking at is, again, learning about, okay, how do we calm this immune system? So there's this whole Th1 and Th2 response. So I started learning about that. And I think one thing was really unique. Then, when I heard Dr. Pompa speak for the first time, what was unique is, as I heard him speak, I'm like, I couldn't conceptualize what I did to get well. And then I realized, like, hey, what he's teaching is what I did to get well. So it was a really great parallel for me, because here's someone who had protocols and procedures in place after I took about 2 years to stumble through doing it. Here's someone who was actually teaching that to physicians, which was great.
And so learning through the process of your story, is how you started to get well. What would you tell people, that are sitting here listening to this? Because there's people watching this live. There's people who are going to watch the replay. There's people who are going to listen to this on iTunes, and there's a lot of people who are out there saying, hey, I've got a lot of symptoms. I don't know what to do. What would you tell them?
First of all, I would say, listen to your body. I've definitely, sometimes it's frustrating, being a practitioner, I always say you never want to treat symptoms, but symptoms show a sign sometimes of dysfunction. Symptoms are either signs of healing or they're signs of dysfunction. They're either one or the other. So I think one of the first things I always will say is are your symptoms signs of healing, or are your symptoms signs of sickness and disease? And I think, once you look at that, one thing I would also say too is that one thing that's not looked at in natural health at all today, and I went through, 2.5, 3 years of actually really traveling to doctors before I really started understanding how to address the gut. Probiotics are great. They do not address the gut. So I think that's a huge thing today. I would say really that, that also too, don't forget this whole connection of the gut-brain connection. I feel it's a huge thing that most physicians may miss. They understand detox, they understand some nutrition in a way, but they totally miss this relationship with the gut. So obviously, that's a huge thing of what we teach people.
Yeah. So obviously, one of the things you just mentioned, fasting was essential for your healing. Were there different fasts that you did at different points in time? I mean, you mentioned intermittent fasting. What other things did you utilize to target that gut-brain connection that we hear Dr. Pompa talk about a lot too?
Yeah. So I did multiple, fasts. I mean, I think I went through, I mean, you name a fast, I've probably done it. I've done straight, bone broth fasts, which we've talked about, on the show, Dr. Pompa's talked. I've done, the pure up, whey water fasts. I've done that. I've mixed those two things together. 2 Christmas ago, just my wife wasn't very happy with me. I went through a fast right around Christmas. I didn't plan it out well, but I did 18 days. Of basically about 4 to 5 days of almost pure fasting, and then I kicked on almost a consistent, intermittent fast for the next 8. It was a total of 18 days. So again, using a mixture of the whey water, the bone broth, also the Beyond Organic products, talking about adding very, very unique bacteria into the gut. Starving down the existing bacteria that's in the gut, and then obviously even now too. Now we know about all the the viruses that exist in our digestive system in our gut. Also that plays a huge role. So, pure fast, 4-day fast, intermittent fast, you name it, those are the type of things that, I did from 4 days to 2 days. When you start fasting, some of it doesn't always go well. So, some of my fasts started at 2 days when I wanted to go 4, but as you start doing those fasts, I can remember, I'm today about 180 pounds, but going through the course of my fasting, I probably got down to about 155. But what was unique about it is every time I broke those fasts, once I was done, I never felt better. And that was a huge thing, is because all of a sudden after these fasts, it was like, now all of a sudden I was less sensitive to food. All of a sudden my energy was changing. All of a sudden my brain fog was disappearing. And that, I think, I know we've talked about the Terrain, right, from Beyond Organic. Have you taken the Terrain products?
Yes.
Yeah. That was one of the first thing I noticed, is how simple is I would take those before meals. So most people take apple cider vinegar, and before a meal, they'll take a little bit and put in water, right, because it helps with digestion. Well, the Terrain, from the Beyond Organic, which has 4 unique acids, I would do a little bit of that before I would eat. That was the first thing was I would notice doing that. I noticed my mental clarity started changing. And that's actually a huge product that I use all the time before foods. And man, that completely changed the way I would actually digest, absorb, and assimilate what I was eating.
So, I mean, you see you today, and, no one would imagine that just a few years ago you had that stroke. Tell us about the journey. I mean, it didn't just happen like this overnight, getting well. It's a process, isn't it?
No, absolutely. I think too, I relate it this way. When I started trying to get well, I think I did a lot of things because I really want to get my health back. And I always say this, I think every path I went down wasn't a right path. But I think sometimes what you do is, you take action, you learn, and you take action, you learn, and you take action, you learn. But yeah, I mean, it was a process. I would say this. I would say I was probably 50% better within weeks of actually, getting out of the hospital and having my stroke. But I think what was tough is for me to get from 50% to 100 where I wanted to be. That journey took me 2.5, 3 years. And so, some of it too was learning. And a big part of that is once I started learning, and the huge thing, which we talk about on the show, is once I started getting my gut well, I was doing the right nutrition. The second thing is that I never was addressing was the cell. And that's again, another misconception, is people forget about how do we influence the cell on the cellular level, because that's all we are. We're cells. So that's another component that it took me 2.5, 3 years to figure out. And once I figured it out, man, from there it was a whole new level of where my health went.
Well, this is, and how has this experience changed your life and how you practice and what you do on a day-to-day basis in working with both chiropractic patients and health coaching clients? Yeah,
I think what it was, when you go through something like that, for me, I think God, it was a great opportunity. I thank God for what I went through, because I think when you live through something like that, it gives me a whole new appreciation for a patient. When a patient comes in, or a client comes in and says, Dr. Brad, I'm not sure where I've been. I do know where they've been. I've been in their position. So I think that's a great thing. But I think also too, it's given me the opportunity, to take time, away from my chiropractic patients and really focus on these tough cases of autoimmune, similar to myself. One thing that was actually in my blood work that, again, doctors wanted to treat me with levothyroxine and testosterone. My body wasn't making testosterone. My hormones were screwed up. I was hypothyroid, autoimmune hypothyroid. So again, even natural doctors I went to wanted to kind of give me hormones to help support me. But, at the end of the day, I knew that those things were, again, those were effects, they weren't cause. So I think once we got to the cell, remove the interference, heal the gut, that's really, again, too, I think where my life really started to, where I went from the 50, 60% better to where I wanted to be.
And so let's talk about that, because you how did your story coincide then with Dr. Pompa? And here's why I asked this. I would actually spend a day with you at your practice, and you had a talk one night, and it was about cellular healing and skincare and the effects and whatnot. Yeah. One of the unique things that I saw was you live this, you breathe this. In your practice, you have videos going all day long. In fact, I got to see some older videos of Dr. Pompa yeah. up on the wall. And the interesting thing was how engaged, because I really got to sit back and just observe as an outsider, how engaged all of your patients who came in for their chiropractic adjustments were into understanding cellular health and eating right and living differently. So how did this all come together?
I think I lost you there, David. I heard you say engage, and then I may have lost you.
Okay. How did your story, you know, did you hear what I was talking about? You guys are showing these videos in your practice. Yeah. Your patients are really engaged. You know, let's talk about how this whole story with Dr. Pompa came about, and, you know, why you chose to become part of our group.
Yeah. Yeah. I think one thing too, you know, is, you know, which I've been fortunate, you know, as far as chiropractically, to be around a great group of doctors who understand, you know, for Maximized Living, understand chiropractic. We have an amazing system to educate people. And then, you know, one thing is that once I went through my sickness, I also realized too that there was a different level of severity, like the autoimmune, the thought, like myself, it was my story. And I realized that there was a part of those people that I wanted to spend time away from my practice to help, because I knew they needed it. And I know that what I had to offer from what I went through could really help those people. I heard Dr. Pompa talk for the first time. And again, what I was saying to myself is, I'm like, man, just what that guy just talked about in the last hour, it took me 2 years of stumbling through to figure that out, parts of it. And that's really, you know, when I said, you know, yeah, for me, it was, I wanted to take some time away from my practice to really help, again, get down to those other patients, again, the 20% of people who maybe wouldn't get well from what I would normally do, and kind of spend that focused time to really build, you know, for clients, these plans that really can transform someone's health who's in a very, very bad position like that.
So let's talk a little bit about health coaching. What type of things are you seeing these days, and what kind of questions are people coming to you with, and what are they facing?
You know, it's interesting. You know, I think one thing that's unique about my story is, you know, a lot of the clients that I have who come to me, and I hear this all the time when we talk about autoimmune, which we're seeing today that so many people have autoimmune, but we understand this, that the testing for autoimmune is it's in the Stone Ages. You know, I mean, there's not great tests. But, you know, one thing that really, and I say this because, you know, I hate, you know, I never look at a patient and say, well, treat your symptoms. But, you know, symptoms sometimes are dead giveaways of, again, I was talking about are these signs of healing or are these signs of disease? And I think, you know, today a lot of the symptoms, the brain fogs, the inability to lose weight, the hormone problems, from thyroid to testosterone to adrenal fatigue, these are all, again, what I call, you know, these are the conditions that a lot of our patients have. And I'm finding today that I think a lot of them, most of their issues kind of they're related to their gut. They're related to bad cells, inflammation of the cell membrane. Those are the conditions I'm seeing. I mean, we're seeing a lot of cases that I'm seeing today are even, again, forms of colitis that have actually moved into other areas of the body. That I actually have a client I'm working with now who they didn't think it was possible. He's the only documented case in the country where his autoimmune is actually moved from his colon, now attacking other areas of his body. So those are the type of clients that I'm getting, because these are people that have really been everywhere. And they're saying, hey, why can't I get results? I've done all the treatment that's out there. And I think that's what we provide, is such a unique approach to really addressing that.
And you just brought something up really unique. I mean, there's a lot of people who've been down a road and, you know, they've gone to doctor after doctor, they've gotten test after test, and they're just told, well, this is what it is. You're going to be on this medication. In fact, when I was 22 years old, I was told I was going to be on an autoimmune medication for the rest of my life. And oh, by the way, these are all the list of symptoms that it can cause, and you should expect to see this. And it freaked me out, and I just flushed down the toilet and decided, actually almost like you, intermittent fasting by accident. So I mean, here's the thing. We've got, Dr. Pompa talks about the three-legged stool. I mean, we've got a lot of factors that are going on. We've got, you know, the physical, the emotional, the chemical sensitivities. We've got vaccinations that are going on. You know, how do you what's the best way to make people aware that, you know, it could be the food that you're eating, it could be the environmental situation, you know, how do you explain that to people?
Yeah, it's one of, you know, I think today, it's a great question. You know, how do you explain to people? I think today people realize the fact that we live in this world where nutrition is changing, you know, the presence of GMO. We're looking at the, you know, toxins in our environment. And I think the thing that people connect with, at least from, you know, what I see, is how I think we influence people and how we move. People there realizing that that's there. I think what they're not realizing is that the symptoms they have they don't realize that that's an effect and not a cause. And I think when we talk about going upstream, you know, things like, you know, in my story, I'll give you one thing that was kind of a giveaway. Talk about immune sensitivity. At 3 months of age, when I was vaccinated, I actually quit breathing. I lived on breathing machines for 3 years of my life. So go back in my history.
I never knew that about you.
Yeah. So if you will go back in my history, you think I was maybe a little sensitive to mercury. And we also obviously know today it's very well documented that vaccines, again, they can push. You look at Th2 response and Th1 response. Well, vaccines can completely shift the response of your body. So, you know, so there you go. I mean, my autoimmune could have been started to be triggered at a very early age. And now the presence of 18 years of age, putting, again, one amalgam filling, it's not much. But, you know, these things, they build up over time. And then you get to a point where you hit that tipping point of where the disease starts. And I think that's where most people always, you know, when clients, when I sit down with them, they always have that one thing that pushed them over the edge. And again, that's just there were layers before that sometimes people got to go through and get well. That's why it took me 3 years.
Well, and you just brought something up really that's important, you know, immunizations, and it's a whole huge debate out, you know, these days on a couple things you just spoke about. Immunizations. We have genetically modified foods that are frankly banned throughout the EU, that they won't allow to be sold in all these other countries, and yet they're prevalent here. That's a whole nother story. And so we've got all this going on, and then people hear, oh, I maybe there's people who read and they start getting into natural health and say, well, I'm going to remove my mercury filling and I'm going to get it replaced, or I'm going to, you know, remove my root canals, and then all of a sudden they may feel better for a little bit, and then all of a sudden they get sicker and sicker and sicker, and they don't, you know, it's because they haven't prepped their body well. They haven't figured out a way to catch and grab and bind the toxins and remove them, and all of a sudden, you know, your body releases it, and then it moves around, then it resettles in other areas, and people get sicker. I mean, it's crazy out there today.
Yeah, no, and one thing what you bring up, and one of the things I went through, you know, glutathione, which we all know is the body's number one antioxidant. I mean, your body uses glutathione to remove any toxin from your body. You know, I can remember the process of going through and doing IVs of glutathione, which I always use the analogy. That's not a bad thing. It can definitely help you. But again, when you talk about the way the cell works, unless you influence intracellular glutathione, that's also too the difference of, again, where detox can be good, and again, it can be targeted. You know, so again, I think that's another thing that, you know, that people are starting to learn is that, you know, where a glutathione can be great, unless the glutathione of the cell changes through redox processes, right? That's where I think where really the difference is made in people is that, you know, I use the analogy, it's like you can pull the toxins out of the body in the bucket, but unless you get them out of the tissues and out of the cell, the cell still doesn't work. You build the toxins right back up again. So it's a two-part process, right? You got to remove the toxins from the body, but you also have to re-strengthen the cells so those cells can actually, you know, push the toxins out of the cell. They don't absorb more. Yeah, detox and retox, right?
Yeah. So you actually bring up a really good point. And here's the challenge. You know, it's sort of like I work with businesses, and if a business is sick and they want to get well, they need a little bit more oxygen. They need a little bit more life in their business. What do? Well, you get someone from the outside, sometimes can see a whole lot better than you can on the path of where you want to go and how to connect the dots. Just like a business owner, sometimes in their own little encapsulation, they can't really figure it out themselves. The same thing is, you know, when you're looking about going down a natural route and what to do, having that health coach in your corner on your side that is there to say, okay, ask you the right questions. You know, it's sometimes just having someone lay out exactly, okay, if you do this, if you change your diet this way, oh, you're still eating grains, you're still eating that, you know, well, it's whole grain bread. Well, do you ask the questions about the whole grain bread? So let's talk a little bit about, you know, that health coaching aspect and how valuable that could be for people.
Yeah, it's huge. I hear this all the time when I have patients, especially who've been through autoimmune, and maybe even too, you know, I have a client who comes in and maybe, you know, their son is experiencing symptoms of autism. You know, a big thing is they're like, well, what about the gluten-free, casein-free diet? You know, and so, but it goes back to, I think, what we're learning about food today. You know, so people, you know, it's like, is dairy good or bad? And it goes back to, well, what kind of dairy are we talking about? Because, you know, again, milk has amazing benefits, beta-1 versus beta-2 casein, right? There's two different forms. And I think that's a level of, I think, customization, you know, with patients. People always, your clients come and say, you know, well, where do I start with? And a lot of times too, sometimes you got to start with the gut. Sometimes you got to fix that before you can feed the body. You know, sometimes too, you just need to increase the fats. So yeah, that's a huge thing today, is we're realizing that, you know, things that even, gosh, I remember 6 years ago, yeah, it was Ezekiel bread. I mean, I would still eat that occasionally, but we unfortunately know today, you know, the way this stuff has been hybridized, unfortunately, you know, I never consume it, you know, because we know what it does. You know, it affects the gut, causes leaky gut. You know, so those are just foods that, so also too, I think, customization is huge. Not every person starts in the same spot. You know, I always refer to care as a toolbox, and my job is always to give clients every tool they need to get their health and their life back. When we use them, how we use them, and at what time do we use them is what I help them with.
Any final thoughts that you would like to leave with our viewers and listeners?
Yeah, I would say number one, just you know, I think a huge thing for me, and I guess what I learned through my journey, I would just, you know, say that if, you know, you're listening to the show today and you have issues of autoimmune and you've had issues of hormone problem and dysfunction and brain fog, I would really suggest, again, also do something before it's too late. I think that's a huge thing. We always know that an ounce of prevention is worth a pound of cure. You know, but action speaks louder than words. I hear a lot of people say that, but they don't take the action necessary to it. The second thing I would say too, no matter which practitioner you go to, do not forget this connection of the gut-brain. Because I think, again, from what I went through and what I learned, not a lot of people understand nutritionally how to affect the gut, and then also too, how to affect the cell, and again, how to control inflammation of the cell through, again, the way the body uses fuel. So those are two unique things I would say. Don't forget about the cell. Don't forget about fixing the gut, because those are two things that if you do not fix, you will not get well and you won't get your health or your life back.
Awesome. Well, thank you, Dr. Gorski, for being our special guest on Cellular Healing TV. Next week, we'll be back with Dr. Pompa, and Warren is my co-host. Wish everyone an amazing rest of your week. Have an amazing weekend, and we'll see you next week. Thank you. Thank you, Dr. Gorski.
Thanks for having me, David. Yeah, appreciate it for having me.